Welcome to Making Space For, the podcast where we embark on a journey to simplify, organize, and prioritize our lives. I'm your host, Paige Rabin, and each episode will explore the art of intentional living, helping you make room for what truly matters. In a world filled with constant noise and distractions, it's easy to find ourselves surrounded by things that don't contribute to our happiness or well-being. Making Space For is your guide to decluttering not just your physical space, but also your mind and soul. We'll dive into practical tips on downsizing, right-sizing, and the transformative power of letting go. Whether you're starting a cluttered closet, pondering legacy planning, or seeking the elusive balance between work and self-care, this podcast is your sanctuary for inspiration and actionable insights. Join us as we feature experts, share personal stories, and explore the profound impact of intentional living. Together, we'll navigate the journey towards a simpler, more fulfilling life, one where you have more of what matters and less of what doesn't. So are you ready to make space for the life you've always wanted? Let's dive in. This is Making Space For. Well, before we dive into today's episode, a quick shout out to our flagship company, A Move Handled with Care. As Denver Metro's premier senior and specialty move management expert since 2007, we've mastered the art of downsizing, right-sizing, organizing, and every step in between. From packing and moving to unpacking and staging, our experienced staff represent all stages of life, offering a compassionate touch to what matters most to you. So, if you're looking to make a seamless transition while keeping what truly matters in focus, trust A Move Handled with Care. Visit us at amovehandledwithcare.com or on Facebook or LinkedIn to discover the difference. Let's continue making space for the life you deserve. Welcome to the Making Space For podcast. I'm your host, Paige Rabin, and joining us today is Carol Goslin, a seasoned Medicare broker with over 15 years of experience. 8 years ago, she founded her brokerage driven by a passion for offering great customer choice. Certified and licensed in multiple states, Carol specializes in educating seniors on their Medicare options, conducting consultations and seminars to empower individuals and groups alike. It's important to note that while Medicare brokers cannot actively solicit, they are readily available to field incoming calls and inquiries about their services. By tapping into her experience, our listeners stand to gain invaluable insights into a topic they may not have realized they need to know more about. Whether it's understanding the nuances of the Medigap, Medicare supplement plans, or navigating the complexities of Medicare Advantage and Part D prescription drug plans, Carol is here to provide clarity and guidance. Tune in as we explore her journey and expertise in simplifying the complexities of Medicare health coverage. This is Making Space For, Navigating Healthcare. All right. Well, thanks for joining me this morning. It's been a while since we saw each other, but I'd love to reconnect. And again, this podcast is designed to kind of give people some little tips and tricks. And I think this really fits into that intentional living piece because, you know, so much of what you do is thinking ahead, planning ahead, knowing your options. So I just want to kind of jump right in and, you know, just have you, Carol, tell us a little bit about yourself and your background. You know, what got you into this role and, you know, what kind of makes you great at what you do?
Great. Thank you, Paige. Appreciate it. My name is Carol Goslin. I am a dedicated Medicare insurance broker. I got in the business, it's been almost 15 years now. I am married of 37 years.
Congratulations.
Thank
That's
you.
a long time to do anything.
Anything over 30 years is a long time. Let's see, live in Larkspur, the South Metro area for, I think I've lived in the South Metro ever since we've lived in Colorado almost 30 years. So, and love Colorado. Tried to move a couple of times and came back. I think that's a lot of us. So, love it here. Feel like I live in a resort every day, and apparently a lot of people think the same way. It's gotten very crowded here. So,
Yeah.
I always say I only welcome 65-year-olds.
So yeah, like, and so what does a Medicaid broker mean? What does that mean? And like, why is that an important thing for people to even know existed?
Yes. So, we're all going to get there eventually. You know, we can't stop the aging process. So, Being a Medicare broker indicates that I help and assist individuals in understanding once they really hit 62, 63 is really when I start telling folks, have a conversation with your financial planner and help understand where you headed for retirement. Life goes so fast.
Mm-hmm.
In a blink of an eye, 20 years goes by, and you really have to plan earlier. More so now with the cost of living has gone up so much for everybody, and I tell folks that you really have to start planning earlier. You really do, and I'm really quite surprised at how many people just really, I have no idea how I'm gonna have to work till I'm 100 if I live that long,
Mm-hmm.
and so many folks are divorced and having to do on their own with the sandwich generation, as many of us are in our 60s, is it's really pinching folks every day. So I think for me, what makes me different is my experience, my knowledge, and my patience. I think
That's
that's
an important thing.
more than anything is, oh my gosh, you have so much patience. And I said, it's I think I have a certain kind of compassion, and being a Catholic. I mean, I don't know if that makes a difference, but it's sort of like, it's important to me, that passion and that respect,
Sure.
and that dignity for knowing that people are very vulnerable and very insecure as they get older. That's just the nature of our living, is that
Yeah.
we just become someone who is more trusting, with that more vulnerable. So we really, I think it takes a certain person to really kind of make sure that we get to the point where we're just being really conscious of that.
Well, I mean, I used you personally when my parents hit retirement a few years ago, and they didn't really know how to navigate what was coming next. Like healthcare had been provided for my parents through my dad's employment, and so what did that do? They didn't know, and it was one of those things that, as a the adult child, to help out my parents, I didn't know either. And then all of a sudden it clicked, and I was like, I know who to call. And so I called you, and you met with my parents. And it was the other thing that I loved about it, being an adult child, is that I didn't have to go through all the research and the things that they were asking, and neither did they. They relied on you and kind of had that one-on-one meeting with you to kind of understand, what they had, what they
That's
needed,
right.
and how you bridge the gap. Because so much of this, it like seems intuitive, but I mean, healthcare in general is just so difficult to navigate. And I think, I think about it all the time. I tell my husband this, my son just had some medical procedures done, and I was dealing with insurance and this and that. And I'm like, I have a master's degree and I struggle understanding what they're saying, what I need. And so to have somebody, as a professional like you, that kind of helps navigate even just selecting what is appropriate, what do you need? How do you get comprehensive care that equals what you used to have with this new change? And so I guess, what are some of the common challenges that you see individuals facing, and how do you help them kind of navigate those challenges?
Yeah, so the biggest, and I think, and sorry for my email going up again for the volume time. Yes, yes, your mom and dad, I hope recently again when they made their move. So, yeah, I think the biggest, I think it's the unknown. People think Medicare and I'm just not going to do anything because I don't know what to do. So they do
Mhm.
nothing, which is the worst thing to do, because then you're left extremely unprotected. And it's finding the right person to feel like you're comfortable enough with, to expose I have these big medications and I have all these health issues, and people
Sure.
are, they don't want to tell you that,
Yeah.
unless they were comfortable in opening up with you about it. But I think the biggest challenges is so many folks are, there's a lot more self-employed people like me that have to go out and look for their own health insurance.
Hmm.
And so many folks in their early, 62, 63, often confuse that, oh, 62, I can get Medicare. No, that's your retirement Social Security benefits that come in. So it's the confusion of when the benefits are eligible to them.
Mhm.
So I have so many conversations with 62-year-olds and 63-year-olds that's like, no, you're not ready yet. Medicare is a very specific niche for individuals to qualify and be eligible for. And those are, you have to be 65. If you're under age 65, then you're eligible for Medicare if you have a permanent disability that has been approved by Social Security and you're permanently disabled.
Okay.
Or you have ALS disease, Lou Gehrig's, because that's a progressive disease that folks don't live very long with. So three ways to get Medicare, very specific. So that's the most confusing, I think, part. But the other real challenge is so many people are working past 65, and they're having to work past 65 because they have a younger spouse. I have many people, I mean, in the past week, I can't even tell you how many people I've talked to that have that same situation where I got to keep working because my wife is 10 years younger. And I'm going to leave her exposed with buying insurance on the marketplace for $800 a month for the next 10 years. I mean, not that high, but somewhere around that. I mean, just very high cost healthcare. And so you're really getting individuals where I tell them, I said, well, you need to think about these things. And yeah, maybe you do need to continue to work so that your spouse is able to stay on your group work insurance. And then once you retire, we'll work with both of you at that point. So it's something they don't know because they're told when I'm 65, I got to enroll in Medicare, I'll get a penalty. So I help educate them through that process. Because you have individuals also that are veterans. You have folks that have Medicare benefits through PARA, which is Public Employee Retirement Association. You have people that get Medicare benefits from their employer if they've worked for a large corporation. Federal benefits, people that work for the post office or the government. So there's lots of ways to be eligible for Medicare other than on your own.
And are you seeing some change? Are you seeing some changes? You know, our healthcare system in the last few years, I feel like we've kind of seen some changes there too. As far as, you know, there was Obamacare and the different rules and regulations that came out there. And then, you know, are you seeing trends in people doing less traditional health insurance? Like, is that also something that you're kind of seeing? You know, maybe doing some of these share programs or things like that. Like, are you seeing like kind of the navigation of people just not understanding what's going on in our healthcare?
Yep, and I'm an example of that. I'm actually on a Christian sharing program because I luckily am healthy. Have a few little issues that come up. We all do, but for the most part, I've been in the insurance business for a long time. So I myself, and they always ask me, well, you know, what do you buy? And I said, well, this is my situation. It might be different for you, but yes, you do have, because when you have someone who's 62, 63, that are self-employed and they have to go out and buy insurance and it's $800 a month, and then they have a $1,000 deductible. And I help them understand that you got to pay your discounted cost up to that 8,000, which you'll never get to. Or you take the chance and buy a sharing program, which works great. I'm a result of it in the past couple of years that I've been on one. So yeah, they are definitely coming out of the woodwork very quickly. Association plans, sharing programs where I mean, and there's a lot more of those that are being funded by individuals that are willing to maybe give some extra monies to folks that simply, you know, have families and can't afford to buy health insurance, and they're right there, and they're not on Medicaid, which is state low income program, different than Medicare. Commonly misunderstood. Medicare and Medicaid are not the same thing. Medicare is for 65 and older. Medicaid is anybody of any age that has low income and can qualify. So there is an overlap many times with individuals that have Medicare and Medicaid. That
And
is
you brought
definitely.
up a good point of understanding what your health situation is, because, what is good for one person, you said, well, I'm relatively healthy. I was on a Medicaid or a Medishare program, and we were on it for a couple of years, and they had different rules and regulations. And I have a kiddo that's got some health concerns, and it's not a concern until it is a concern. And when it is a concern, we realized real quickly that he wasn't insurable for the first 12 months of our insurance. We were on a, Medishare program. And so of course, until it is a problem, you don't know. And so I think that's where relying on a professional like yourself. So like you're saying, it is a vulnerable space for people to have to say, this is my health concern. These are the medications I'm on. Here are the doctors I have to make sure are covered under my plan. You help them navigate those challenges. And so I think that's a lot of people don't know that that service is out there. And so how are you, what is the cost to a person trying to come for your services? What does that look like for them?
Well, the good part is it's no charge. So we as Medicare brokers are held to a very high standard. I sat through almost a month of training. Had no idea how I was gonna left that training after a month going, oh my gosh, how am I gonna explain this to people? How am I gonna explain what Part D is and all the stages of prescriptions and the cost of prescriptions and all of the pieces of Medicare and the choices and how do I help them? And well, that came with 15 years later of experience of doing nothing but Medicare products. I don't dabble in much else, very little else. I really like to hone in on the expertise of Medicare because you can't be an expert in everything.
Yes, I totally agree with that. Be good at
So,
what you're good at.
yes. So with that, we go through extensive annual Medicare certification training. Of course, every 2 years I get my CE training. It's continuing education that's required to be able to license and update my license in Colorado every 2 years. I am also licensed in 7 other states because a lot of people are moving from Colorado, so they want me to help them transition to that new state's health plan. For which I am, as I'll add, South Carolina, Georgia, Florida, Arizona, Iowa, and New Mexico.
Okay.
So far. I mean, I keep trying not to add any more states, but it seems like people are kind of flocking to the Northeast and those Carolina states, seems like. So we as Medicare brokers are not permitted to charge any fee. So if any broker says, oh, I charge a consulting fee, that is against the rules and against the Medicare compliant rules. They should be reported. So we are a free service to a consumer. So I will sit with them as long as needed with multiple meetings. And I'm kind of old fashioned. I like to do in-person meetings. I like to meet the people I work with. Many times when we have remote issues, like out of state, when we can't do that, we can either do a Zoom meeting or we can do a phone meeting to get things going for them and to make sure that we have that. So COVID really changed the dynamic of my business extensively because it was all of a sudden, what do you mean I can't see people?
Yeah.
Which was I love to be around people and I love to be sociable, and that was really hard for me to transition as it was, I'm sure, a lot of other people. But that also brought in, as it did with a lot of other folks, it brought in other tools that we were required then to use to enroll folks. I mean, we needed to find, and I write for every carrier. So I write business for all of the major carriers. The only exception I don't write for is Kaiser. I don't write their business, or Denver Health. So more closed network, more specific to individuals' needs. And it's a choice that brokers have a choice to ensure with who they want to be paid by. If they want to work with, we have that choice. We are actually paid by the insurance company when we make the enrollment. So that's how we're compensated. So we are compensated as insurance agent on a residual basis every month for as long as an individual is on our book of business. So we are a servicing agent. I stay in touch with my clients with birthday cards and phone calls and emails and kind of old fashioned there too. I like to write birthday cards, and
I
that's
think
just
that's great. We talk about it all the time is like, it's that person centered first. And
yeah.
it just helps not only that, but it helps your business. It helps you stay in touch because sometimes you'll get the birthday card and all of a sudden you're like, you know what? I really need to talk to her. I'm having some upcoming thing. So it's while you think it's just a birthday card, I know on the other end of it too. Like sometimes I just actually got a card from a professional colleague. And I was like, you know what? I actually was just thinking about her. And it's a great way to
Funny.
connect in that
Yeah.
way for sure.
Well,
So
and
I don't think that's old fashioned. I think we need to keep that in our business
yeah.
for sure.
Yeah, we're and thank you cards. We're in a virtual world so much,
Yeah.
and even seniors have really jumped on board with virtual. You wouldn't believe. I mean, I get text messages from 95 and 99 and
Yeah.
100-year-olds all the time, and I kind of, wow, we're texting now. And of course, you can't get away from texting on Saturdays and Sundays when you really want to take full time off. So it's kind of funny, but I myself like, reading a book and a hard copy book and love receiving cards in the mail. And I know it's a fact because I've been told from from my clients, they say, your card's the only one I got.
Yeah.
So they haven't been forgotten. And,
Yeah.
folks that live alone and seniors that live
Yes.
alone, if they're not visited by their family and people get busy,
Hmm.
um, that's a touching point. And I put a balloon in it, or I've done gum in them before, and slip my business card in case, do you need to talk to me, or do we need to chat? Give me a call, and just
Sure.
trying to make another connection. And I think people really appreciate that. And then they think, well, you know what? So and so's turning 65, or and that's thankfully and gratefully as I am, I'm entirely grateful for the referrals that I receive, and that's how I build my business. And I can't tell you how that's the biggest reward and the biggest compliment anyone can get is a referral, and it's that just touches my heart. That's what I love the most, is helping people.
Great. Well, I told you that the title of our podcast is Making Space For. We are trying to create intentional living, helping people downsize, declutter. And it doesn't just mean the stuff, it means all the other things. So how does someone using your services, help free up that space so that they can focus on other things during life's big transitions?
Well, big thing is helping them understand what the differences are. So when I speak with someone and they're approaching 63, 64, another big issue that commonly comes up, especially if we have self-employed individuals, is the cost of Medicare.
Mm-hmm.
What a lot of folks don't understand or know, because you can go through your Medicare and You handbook, or you can go to the Medicare.gov website and get lost and fall asleep and just kind of,
I
oh,
can imagine.
that's just a lot of information. And there's a lot of parts: Part A, Part B, Part C, Part D, Medigap, Medicare supplement. What's the right thing for me? So I help. Education's a large piece of this business, and understanding, because nobody's going to make any decisions if they're confused, and they
Right.
shouldn't.
Or make bad decisions if they're
Right,
confused.
right. Yeah, then they end up doing nothing, and then they end up getting into that sort of little situation where, oh my gosh, I should have done this, and now I have a penalty because I didn't do anything, because I didn't know what to do, and I didn't
Right.
want to pick something wrong, and I just didn't do anything. And I have a lot of I help a lot of people in that situation when the open enrollment comes around in October, in the fall, for a new plan for the next year. And I have to tell them, I'm sorry, you have a late enrollment penalty to Medicare because you didn't buy a Part D plan. Well, I didn't have any prescriptions. Why should I buy a Part D plan? Exactly. The purpose of the education piece is why you need to.
Right.
And why I think it's important for you to, because nobody likes to pay for nothing. Nobody likes to pay something and get nothing in return.
Right.
So, and many times that's a surprise. The other big surprise is they pay a larger amount for Medicare because they are a high income earner.
Mm.
There's a specific chart on the Medicare.gov website that changes every year, and Medicare will increase your premium to Medicare, to the federal government, for a part of your benefits to Medicare, to get basic Medicare benefits, if you make above a certain income.
Hmm.
And that's often the big surprise. And that income, I mean, they could pay $100, $400, $500 a month more than the standard amount for the entire year, which is not fun to explain.
No, I bet not.
And yeah, the standard Medicare premium for Part B, which is the only paying part of Medicare, is $174.70 a month. So that's relatively low in
Yeah.
comparison to what you pay for individual health insurance.
I was gonna say, or
now.
I'm thinking about my family insurance. I'm like, man, what a bargain.
Oh, that's per person per month. And then you add, a second or a supplement.
Sure.
It's far less to be on Medicare, which is kind of why, you hear so many initiatives that, gee, everybody should be on Medicare. Well, if everybody was on Medicare, we know that it wouldn't be as low as it is now.
Right. Wouldn't be as affordable for sure.
Exactly. So that's why it's an earned benefit.
Okay.
Versus, that's exactly it. But so it's really that education piece of, that's where I start when I start with an individual. I talk with them about what their needs are. Are we talking about insurance at work? Do you have a spouse to cover? Do you have dependents to cover? Because there's still individuals that have kids at home and they need to continue working even though they're past 65 to cover their dependents at home. So we have all those discussions on who do we need to protect for this insurance. And then, what are the other components that are important? How much are you going to pay? What state are you going to live in? That's also a little different when it comes to the added coverage that I offer. So there's a lot of discussion around the education piece. And then I tell them, well, then they go, I don't know what to do. Should I just keep working? Do I go on Medicare? And I help them explain, and we go through an outline of, well, what insurance do you have at work? Send me an outline of it, and we'll talk about what your basic Medicare benefits will be under Medicare. And I'll give you the facts, but I can't tell you what to do. But I'll give you so you're a little more educated, so you know what to do.
And would you say that most people, once they kind of make a decision after you've given them a plan and an outline, that they make a decision and it's kind of a one decision and done? Or is it do you notice that a lot of your customers potentially make a decision and then that you help them navigate through, maybe the duration? Is there a common way of doing that?
Well, I'm because so many folks get to the situation where they don't know what to do. And I said, you're not making a choice for your life. You're only making a choice for the rest of the year.
Right.
The option that Medicare offers you, just like at work, or just like, there's something called the annual enrollment period. So don't get overwhelmed with your decision. If you feel comfortable, which I feel comfortable with this decision today, we're going to go with this today. This is going to start such and such a date. And then we're going to visit during the open enrollment period and see how things are going. Is it working for you? Is it not? What needs to be fixed? And we take that opportunity and change it if we can. There's very, very specific times that individuals can change their plan, but there's always an annual enrollment period that everybody sees on TV with all the ads starting.
Yeah.
It's annual enrollment period for Medicare. You have to do something. Well, not necessarily.
But I mean, it sounds like somebody getting involved with a Medicare broker. What it sounds to me like, is that you making the initial decision to get hooked up with someone like you makes that process. Now they've done the hard part. They've done all the understanding and the education, and now they just get to tweak it. And you have somebody that's in your corner that's helping support you. That's, not a family member. It's not somebody who's not educated in that space, that you're going to give them kind of the best information as they go and when they have questions and as employment changes and a spouse passes away and all the different things that happen. Now they've got an advocate. So they're freeing up their space, if you will, they've made the hard decision once. So it's not a decision that, like you just said, it doesn't have to be set in stone for the rest of your life, but they've made a decision to set themselves up for success.
Right. And that's, and if it, and that's the opportunity that is yielded to them, is the fact that just like at work, you're not making, you have more choices than you do
Yeah,
at work, because your employer's only going to give you maybe two insurance companies to choose from, but you can change every year. But
sure.
under Medicare, you've got a plethora of offers that you can choose from. And people, some people are overwhelmed. And that's where I really kind of have to narrow it down for them to help them make a decision. Because,
Sure.
if there's not a underlying reason as to why they need to go with one particular insurance company first, then it's, well, let's help whittle this down from 25 different plans to one, and
Sure.
sometimes more, because it can be daunting, and I help them make sense of it, where I kind of go, I mean, talking about prescriptions takes about 30 minutes sometimes. So another thing that a lot of people are quite underwhelmed about, or maybe over, is how long an appointment lasts. I mean, I can be in a house call for 2 hours. I can blow an hour by in no time.
Sure.
So they say, "Oh, I got an hour." I said, that's gonna, and if it's a husband and wife, no way. I said,
Yeah.
well, that's not gonna work. We need two. And I say, well, we need about an hour and a half, probably more. So when in your schedule can we carve out that time? I mean, I'll do Saturday appointments if I need to for an in-home appointment. I prefer to set with a Monday through Friday, but I'll do Saturday because a lot of people work Monday through Friday,
Sure.
and they want, and a Saturday appointment might be easier. So I make my appointments flexible depending on what their schedule is as well. But it's really going through so much of the education piece, understanding their situation, who else is important, do we need to get family members involved? And I know we've got a little bit of time left, but I want to mention that it's real important to get kids involved with older adults.
Yeah.
And a whole big cognitive issue comes in as folks, lose that ability to make their own decisions, and you've got guardianship or conservator or power of attorneys that step in. And that's something we as brokers are taught and educated on, how to be
Great.
sensitive to that
Yeah.
cognitive ability if we feel like someone doesn't quite understand. And it's not an easy topic.
No. Ugh.
You don't expect them to understand it. They're lost in 5 minutes.
Right.
So it's something where I rely on the family. And if I feel like I'm in front of someone that doesn't have that ability, I can tell it over the phone before I make the
Sure.
appointment. So I know enough to have the foresight to say, do you have family members, or do you have usually I
Yeah.
hear from our attorney anyway on these topics, but I won't take the next step, because I'm not going to put that individual at risk, nor am I going to put myself at risk.
Sure.
I have a reputation and a compliant standard to withhold under Medicare, which I take very, very seriously. So, when you run a business, you do the right thing.
Absolutely. Well, I appreciate you helping my parents and, kind of opening my eyes to this thing too. And I feel like sometimes we don't know that these services exist, and that you can free up this level of anxiety or fear, or like you're saying, like just absolutely doing nothing, just, getting stuck in doing nothing. And so I'm just so glad to know you and others like you that, provide this service for people to help them navigate, because you're right, insurance is not easy. And I appreciate you sharing with our listeners today too, because again, I think education is number one, paramount, and helping people live kind of intentional. So I guess my very final question to you is, when should folks get in touch with someone like you? Is there an age? Is there a life transition? What is kind of the magic thing that happens where people should start this journey?
Well, a few situations, age-wise, if they're eligible for Medicare at 65, as we know they are, I would say 63 would be a good 62, 63 age, just to help prepare for. Do you plan on working past your 65th? Do you have spouses or dependents to insure? Are you going to be moving? Every plan is different from state to state. Federal
Okay.
benefits are the same because they're federal, but the health plan benefits are different from state to state. Are you eligible for perhaps Medicaid benefits in addition to Medicare benefits when
Okay.
you're upcoming eligible for 65?
Great. So it
age
sounds like 62-ish is when we're
Yeah.
thinking about this, planning ahead, finding the right Medicare broker in your area, because listeners can be from any state. It's great to know you here in the Denver metro area. And I thank you personally, and I thank you professionally for being a stand-up gal and just providing an amazing service to people. So thanks for joining us today, Carol.
Thank you, Paige. Appreciate it. Thanks so much for letting me be on your show. Appreciate it.
Absolutely. See ya.
All right. Bye now.
That wraps up another inspiring episode of the Making Space For podcast. A huge thank you to our incredible guest and to you, our cherished listeners. Your journey to intentional living begins with each small step, and we're honored to be a part of it. If you enjoyed what you heard today, please consider liking, subscribing, and rating our podcast on your favorite platform. Before we part ways, a friendly reminder, if you're embarking on a move or seeking expert guidance in downsizing, remember A Move Handled with Care in Denver. With over 15 years of experience in senior and specialty move management, we're here to transform your transition into a seamless, stress-free experience. Visit amovehandledwithcare.com for more information, and let's continue making space for the life you've always wanted. Until next time, stay inspired, stay intentional, and keep making space for what matters most.